America, planet Earth, citizens of the universe. My name is Joe Nice, and as always, today's date is December 8, 2020, December the 8th, 2020, December 8, 2020. I'm not going to take up a whole bunch of your time today because I know your time is valuable, as is mine, and I want to make sure that everybody gets something from what I'm going to talk about today. Just a couple of personal notes. I realize that today is December 8, 2020. On this date 5 years ago, my divorce was finalized. I'm not exactly celebrating that. I'm commemorating that. And I know I said this in an Instagram story a couple of months back. I said we're either going through a storm, in the middle of a storm, or waiting for the next storm to come. And I remember how my life was 5 years ago, and I know how my life is right now. And never to give my ex-wife any sort of credit, but that divorce is the best thing that ever happened to me. My divorce was the best thing that ever happened to me. Because my divorce meant freedom. My divorce allowed me to do what the fuck I want. To live my life the way I need to be living it. I didn't see it then, but I damn sure see it now. I didn't see it then, but I see it now. And I'm a much better version of myself now than I was on December 8, 2015. I guarantee you that. So I just want to go ahead and share that with everybody before I continue on with what I'm going to talk about today. Today's conversation is going to focus on healthcare and Medicare for all. Today is December 8, 2015 in the United States because we have a terrible healthcare system. For those who are not connected to a job, there is a period of enrollment through the state exchanges for healthcare called open enrollment. And open enrollment to purchase health insurance so you have health care expires a week from today, December 15th. Expires December 15th. And right now, our government, the senators and the congresspeople in the United States are negotiating a stimulus package. That's what they're calling it, a stimulus package, where there is no Medicare for all attached to this bill at all. Nothing. There's no health care. In the middle of a deadly pandemic, where coronavirus cases are spiking through the roof and people are dying left and right in the streets, there's not a single bit of healthcare for anybody. Nobody in Congress is saying, hey, you know what? We should add Medicare for all to this stimulus package. Because you know what? We're in the middle of a pandemic and people are dying. Nobody in Congress is talking about Law 1881A of the Social Security Act, which gives you Medicare in cases of an environmental hazard. And again, and Kat and I are going to do an entire episode about this. The people of Libby, Montana got health care because of an environmental hazard, asbestos. But Flint, Michigan didn't get it. Baltimore, Maryland didn't get it with the lead paint and the lead in the water. And I would certainly think an airborne virus like the coronavirus or COVID-19, whatever you want to call it, is an environmental hazard. I would certainly think it's an environmental hazard. And we're not getting any sort of health care. Now, I don't want to hear anything from politicians saying, oh, well, you know what? Now Joe Biden's in and now we can possibly fight for Medicare for all. Joe Biden said he's not giving us Medicare for all. He's not doing it. He's not giving us health care. And for everybody in the streets, and I appreciate each and every one of you, when exactly is the timeline to fight for Medicare for all, for health care for everybody? Every other developed nation in the known universe has health care. There are right-wing governments in Europe that have health care. Boris Johnson, who is the Prime Minister of the UK, who is essentially the British version of Donald Trump. He's like, hey, yeah, we have healthcare for everybody. And he used the NHS, the National Health System, when he got the coronavirus. I've spoken about France over the past few days. Emmanuel Macron, who I think is terrible and needs to resign because he's a completely illegitimate leader of a country. The French people have healthcare. So if you wonder why 150,000 people can march in the streets 2 weeks ago, and then a whole bunch of more people can march in the streets this past weekend, you know why? They have health care. Hungary's prime minister, Viktor Orban, who is a disgusting and despicable human being. Hungary has health care for everybody. Austria's prime minister, Sebastian Kurz, I think is the guy's name, who recently said that migrants are the reason that COVID-19 cases are spiking through the roof. You know what? You know what Austria has for everybody? Healthcare. And these are right-wing demagogues in Central and Eastern Europe that are like, hey, you know what? Yeah, we're right-wingers. We're anti-immigration. We're anti-refugee. But you know what? Everybody in our country gets healthcare. But in these United States, there are 50, maybe 60 million people who don't have health care, and even more who are underinsured. Think about that. I want everybody to let that one marinate for a couple of minutes. In a democracy with a democratically elected president, we, the richest country in the world based upon gross domestic product, do not have health care for everybody. But then there are underdeveloped countries in the world who have health care for everyone. India, I spoke about India over the past 3 or 4 days. 1.35, 1.4 billion people. Guess what they have for their country? Health care. And everybody gets it. But for some inexplicable reason in the United States, America does not have health care. And now, because there are more people that don't have a job right now, you have to go through open enrollment. And if you go through open enrollment, you would better hope that you get it done within the next week. Because if you don't enroll within the next week, you don't get health care until this time again next year, unless you're lucky enough to get a job. And if you get a job, you're lucky enough to have an employer that's willing to sponsor your health care. So now you all see why I've been saying for the better part of, 18 months now, we need a yellow vest movement and America needs to go on strike. And for those of you asking, okay, well, hey, Joe, what is our healthcare system? What is our healthcare system? Why is our healthcare system such bullshit? Why is it? I'll happily explain that to you. In case you haven't watched the Joe and Kat Chats episodes about healthcare. We've done 2 episodes about healthcare so far. 2 of them. And speaking of two of something, I have 2 master's degrees. One of these master's degrees is in a discipline of healthcare from Wake Forest University, one of the top 30 universities in the United States. So I understand the Affordable Care Act a little bit better than most people. So we'll talk about it. I'll spend a few minutes talking about this. That way you all understand what exactly the Patient Protection and Affordable Care Act is. So you all understand, okay, wow, this is a really shitty healthcare plan. We actually do need Medicare for all. And we're going to talk about it. Now, when Barack Obama campaigned to be president in 2008, he said, hey, you know what? We're going to make sure everybody gets healthcare. Everybody. If you're an American, you're an immigrant, you're getting healthcare. We're going to make sure you get it. So what did he do? His political opponent at the time was Mitt Romney. Mitt Romney was a former governor of Massachusetts. When Mitt Romney was governor of Massachusetts, the people of his state had said, hey, yo, Governor Romney, we need a healthcare plan. These private plans are too expensive. We need something that's state managed so we can control the cost and everybody can get in on the deal. So he said, okay, hey, you know what? Have a dozen Dunkin' Donuts because it's Massachusetts. They like their Dunkin' Donuts up north. And we're going to sit down and talk about this, and I'll have something for you in a little bit. So what does he do? He consults a right-wing think tank called the Heritage Foundation. The Heritage Foundation comes back and says, hey, you know what? We got an idea, Governor Romney. Here's what we're going to do. We're going to push this out to your people. We've got what's called a three-legged stool model of healthcare. The three legs of the stool, or the three pillars of this of healthcare, are government subsidies, access to insurance, and a fancy rule called the individual mandate. Government subsidies and access to insurance, okay, you don't really need to pay too much attention to that. What I need you all to focus on is that fancy rule called the individual mandate, because that is really where the bullshit happens. Now more than ever. So, but remember, three legs of the stool: access to insurance, government subsidies, individual mandate. Three pillars of the stool of the healthcare law. So President Obama says, hey, you know what? That whole mass care thing that Romney had, that everybody in Massachusetts calls Romney Care, you know, I like that. That looks pretty good. I think we'll just essentially nationalize it and add a couple of changes, most notably the age in which you can stay on your parents' insurance and changing the individual mandate penalties. Now, many of you all are probably drinking, having some brunch or eating some lunch, or maybe just getting up or waking up or doing some yoga right now, or you might be watching this video. You're like, hey, well, Joe, nice. What is the individual mandate? The individual mandate is a fancy rule stating that you, the private citizen, must buy a privately owned product. And if you, the private citizen, do not buy that privately owned product, we, the public in this instance, meaning the government, most specifically the Internal Revenue Service, will institute a penalty for you for not buying that privately owned product. But make sure that might have gone over some of your heads. So let me give you all a different example. I've got 3 kettlebells over here in the distance of varying weights. Let's say the federal government said, hey, you know what? Private citizen, you have to buy a kettlebell because it's part of our new exercise plan. You have to buy a kettlebell. And if you don't buy a kettlebell from any of these companies, whether it's Great Lakes Geria or Dick's Sporting Goods or through Target or Walmart or Amazon, wherever, we don't care where you buy it, but there's only so many people that you can buy kettlebells from, or Kettlebell Kings. If you don't buy a kettlebell, we, the government, will assess a penalty to you for not buying a kettlebell. Now, again, this may be a bit of an esoteric example, but I'm using it to illustrate the point. Could you imagine how much anger and frustration and vitriol would come towards the federal government because the government said, hey, what? I have to buy a kettlebell? What if I don't like swinging kettlebells? What if I just want to do jump rope? What if distance running is the way I stay in shape? Or yoga? What if I just want to lift weights? How come I have to swing a cannonball with a handle on it and buy one? I'm only forced to buy it from these companies. But because health insurance is an intangible and you only call on it when you need it, no one really said anything. Not that many people complained. And because you had a black face in a high place in Barack Obama, everyone said, hey, you know what? Sounds good to me. Let's go for it. So that became the healthcare law of the land. And it was ratified and was signed into law in March 2010. So the healthcare law of the United States is a little bit more than 10 years old. Now, when President Trump campaigned for the presidency and said, hey, you know what? Yeah, I want to be president. I want to go ahead and repeal and replace Obamacare. He didn't actually have a plan to replace the Affordable Care Act. He just wanted to repeal it. And he knew, again, the 3 pillars of the law: access to insurance, government subsidies, individual mandate. And access to insurance came through a fancy rule called the Medicaid expansion. Where, and again, the Medicaid expansion is somewhat involved. I don't want to spend a whole lot of time discussing that. You can watch episode 5 of the Joe and Cat Chat series to kind of figure out what exactly the Medicaid expansion is. It involves federal poverty limits. There's the coverage gap. There's a lot that we can talk about, but I don't want to go too deep into the weeds in this. Just know that Trump couldn't go ahead and repeal bits and pieces of the law because you need all three pieces of the law to stand together. That would have been too time consuming and costly to legislate the Medicaid expansion out of the law, out of the Affordable Care Act, which I don't think you could do anyway, or somehow get rid of government subsidies. And government subsidies came from the federal government to the states in what is called a block grant. And these block grants were large sums of money that were given to each state, and the states had to spend that money on healthcare. And the states were eligible to pay up to 90% of their healthcare costs with that block grant. All the states had to do was come up with 10%. Federal government said, hey, here's 90%. All you got to do is come up with 10%. And I think currently right now, 38 states have accepted the Medicaid expansion. 12 have not. I live in one of those 12 states that did not accept the Medicaid expansion. So there's a whole lot of low income and low wage earners who are not eligible for Medicare because the government, the state government did not accept the Medicaid expansion. Medicaid. So in 2017, President Trump said, hey, you know what? I've got a fancy law called the Tax Cuts and Jobs Act. We're going to go ahead and cut taxes for a lot of really rich people. And inculcated in this is we're going to go ahead and reduce the individual mandate penalty from $695 for a family or $2,000. I'm sorry, $695 for an individual or $2,000 for a family to exactly $0. So before this Tax Cuts and Jobs Act became law, if you were a young, healthy person and you did not want to buy health insurance, you had to pay a penalty for it. Now, if you're a young, healthy person, you don't have to buy health insurance. For what? What do I need health insurance for? And you could use that money for other reasons, other purposes, like, I don't know, paying off student debt. So the federal government said, okay, well, you know what? Yeah, we now have a whole lot of people that aren't going to buy insurance. So health insurance companies raised their rates. And the health insurance rates were already exorbitantly expensive because everybody was forced to pay into the system, which you think would actually lower health insurance costs. But health insurance companies knew that they were getting money hand over fist, so they raised the rates anyway. So now, based upon actuarial science, the people who are most likely to use insurance, old, sick people, are paying even more money for health insurance. And now there are fewer people paying into the health insurance aggregate or pool. So now you have even more increased costs because there are fewer people paying into this system to spread out what's called the risk. So if you wonder why health insurance is so expensive now, there it is. So again, we had a Democratic president in Barack Obama that gave everybody a Republican health care plan. And if Mitt Romney had been elected president of the United States back in 2008, care to guess what health care plan we would have had? The exact same one that Barack Obama gave us in 2010, the Affordable Care Act. But it wouldn't be called Obamacare, it would be called Romney Care, just like it was in Massachusetts. And again, when I keep saying we need to go on strike, it's not just to make sure that we have an economic relief plan as a result of the coronavirus. It's also to make sure that everybody gets health care. We need to fight for that also. This is not just a unilateral, omnidirectional issue where it's, hey, you know what? Yeah, we want to make sure that we get universal basic income payments and unemployment insurance payments, and we stay home. It's got to be more than that. And when I talked about this yesterday, on one of my list of demands, I said Medicare for all. Everybody gets health care. Because if the federal government can go ahead and find nearly $5 trillion to buy the banks, to pay the banks, to give to the banks to let them borrow, and they're giving the banks $1 trillion a day, they can find money to make sure that our healthcare costs are paid for and taken care of. And in the long run, it's actually less expensive than the system we have now. Considerably less expensive. So again, I have a couple of notes and I want to make sure that everybody understands. One of the notes that I have is if you need to get health insurance, you can go through your state exchanges. You can look them up. There's another website, ObamacarePlans.com. Again, if you need to buy health insurance and you are out of work and you need to figure out what you can possibly afford to make sure that you have health insurance in the middle of a deadly pandemic, ObamacarePlans.com. 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 So to make sure that everybody gets what they need, because, again, we are in the middle of a pandemic. We're in the middle of a pandemic. A couple more notes that I have here to make sure I get this correct because I like being a correct brother. All right. If you go through the state plans, there are 3 levels that you can have. You can have gold, silver, and bronze. Gold is the most expensive. Bronze is the least expensive. But even the bronze plans are incredibly expensive. I have some data here for an individual market, and that means you go through the state exchanges for a 50-year-old enrollee. The average premium cost is $5,688 for a bronze plan. For a silver plan, $7,584. For a gold plan, the average premium is $8,628 a year for health insurance. So for the gold plan, $8,628, 12 times 7 is 84. You're looking about $720, $730 a month for health insurance. For the silver plan, $7,584. 12 sixes are 72. So you're looking about $625, $630 for the silver plan. Bronze plan is $5,600. 12 times 5, 12 times 4. You're looking about $475, $480 a month for the bronze plan. Now, again, the way insurance works is the higher your premium, the lower your deductible. And a deductible is just a fancy way of saying, hey, how much are you willing to pay out of pocket? Or how much, let me rephrase that. How much are you willing to self-insure yourself? Because that's really what a deductible is. Now, again, the average deductible on a bronze plan, and again, the bronze plan, the average premium per year is $5,688. The average deductible is $5,977. So that means if you go to the hospital, you're essentially on the hook for $6,000 of your own care. The average deductible for a silver plan is $4,043. Again, if you go to the hospital and you have a silver plan, you're on the hook for the first $4,000 of your medical care. The average deductible for a gold plan, where you're paying a little more than $700 a month for health insurance, is $1,581. The average deductibles. Who can afford that? And again, that's if you don't have a job or you don't have an employer that will sponsor your health insurance. That's what you're looking at. And again, those are for a 50-year-old enrollee. Granted, if you are younger, those prices would probably decrease a little bit, but not by much. So imagine a gold plan. You're paying $700 a month, a little more than $700 a month. And again, minimum wages, the fight for 15 is $15 an hour. 15 times 40 is $600 a week. 600 times 4 is $2,400. Take out taxes out of $2,400. You're looking, let's say 75, 80%. you're like 420, 420, 840, 840 times 2 is $1,680. You're taking home about $1,680. Let's just say $1,600 just for fun, just so the numbers work out. And again, this is if you're making $15 an hour and you're working 40 hours a week. Your take home per month is going to be $2,400. After taxes, about $1,600, maybe a little bit more. Let's just say $1,700. Let's say you bought a gold plan. You're paying about $700 a month. You're left with $1,000. Okay, where are you going to live? Where are you going to live? You got $1,000 left. Where are you going to live? What about gas? What about food? What about internet? So again, when I talked about Medicare for all on my list of demands that I had on my sign yesterday, when I talked about universal basic income, let's not forget the CARES Act gave everybody $600 extra per week. $600 divided by 40 is $15. What the federal government gave everybody is essentially a minimum wage weekly payment as unemployment insurance as an extra uninsurance payment. They gave everybody $15. They essentially said, hey, we'll pay you $15 an hour based upon 40 hours of work week to stay home. And that was in addition to whatever you were receiving from your state and based on unemployment insurance. Think about that. They gave everybody $1,200 checks, and if you were lucky to get the extra $600, good for you. And again, the federal government gave nearly $5 trillion to the biggest banks and the richest 1,000 people in this country. And again, look at the scenario I just put out there for you. Look at what I just talked about in terms of numbers, tangible numbers. If you're making $15 an hour, you're making $600 a week, $2,400 a month. Your take-home pay every 2 weeks is going to be your monthly pay is going to be about $1,700. And if you buy a gold health insurance plan, if you work for an employer that doesn't sponsor health insurance, if you want to buy a gold plan because you don't want to be stuck with a nearly $6,000 deductible, you're paying $700 a month, and you're left with $1,000. I didn't talk about internet, food, rent, gas and electric. And let's say you have some student loans. How are you paying student loans with $1,000 left over in your pocket? How are you paying rent with $1,000 left over in your pocket? What if you got a couple of kids? What about childcare costs with $1,000 extra in your pocket? Our government has legalized bribery. It's organized corruption. And all 538 members of our government are morally bankrupt. They're morally flabby people. There's no spine, there's no backbone, there's nothing to any of them. And again, if I can just go ahead and if I can do what I just did in the past 29 minutes and 39 seconds with making a case for why we should have Medicare for all, then why the fuck can't anybody else in Congress do the same thing? Better yet, why didn't Barack Obama do it 10 years ago or 12 years ago when he was campaigning? Why not? Again, the furthest right-wing governments in Europe have healthcare. Undeveloped countries across this planet have government-managed healthcare for their people. We, the United States, richest country in the world, are like, this whole healthcare thing, we can't give it to everybody. Can't give it to everybody. Again, we need to be in the streets. We need a goddamn strike in this country. Shut every fucking thing down. Shut everything down. And I said it yesterday and I'll say it again. If workers in California and Texas decided to unite and fight, shit would get done. And again, because if 250 million people, 250 million people in India can say, hey, you know what, we don't like what's going on here. We're going to shut this down. And we'll sit this out. We'll wait for as long as it takes because we're going to get what we want. If they can do that, then why the hell can't we do this in America? Enough is enough. Enough is enough. And right now, what we have is a government that is giving us the bare necessities. And they're not even doing that. They're not even doing that. Two and a half or 3 months ago, Nancy Pelosi said, hey, you know what? This $1.8 trillion is not even half of a loaf. Now she's negotiating half to hopefully get half of a loaf. AOC 8 months ago, when she voted on the CARES Act, said, this is crumbs, to use a bread analogy. This is crumbs. If the CARES Act, which actually helped lift people out of poverty, and the CARES Act wasn't enough for people, and she called it crumbs, then what is this that we're about to get? Maybe. And that's if the Republicans in the Senate say, hey, you know what? Yeah, okay, fine. We'll give you $908 billion. And there's already pushback on that from Senate Republicans. And everybody's saying, oh, Nancy Pelosi's a master negotiator. I wouldn't ask her to make Pop-Tarts. I wouldn't trust her with making toast. I wouldn't trust her to do it. I wouldn't trust her to manage a lemonade stand around the corner from where I'm living. I wouldn't trust her to make ice. She's going to say, hey, yep, this is a great deal. And that bipartisan group said $908 billion. There's already Republicans saying, no, we're not going with 908. We're not doing that. How much you want to bet this bill is going to be something like $650, $700 billion? Again, we have a morally bankrupt, and we have a unintelligent group of people that are in charge of our government right now. Not only are they unintelligent, they're amoral. Not even immoral, amoral. Because it's amoral to think that having healthcare for everybody is radical. When damn near every other country in the world has a healthcare system where the government looks after their people and their health. For some stupid reason, we don't have that in the United States. Boris Johnson can't even comb his fucking hair. And he was like, yo, thanks to the NHS, they saved my life. And I'm going to make sure I say that again. Boris Johnson can't comb his hair. And the NHS, the National Health Service in England, saved his life. They've had healthcare in England for 80 years. Canada, thank you, Tommy Douglas. They've got healthcare. And it's good. But we in the United States, no, we can't do it. But these fuckers in Washington, D.C. just found $740 billion from World War. Let's go ahead and bomb more people instead of taking care of our own people right here in this country. Enough is enough. Enough is enough. When your politicians look you in the eye and say, hey, you know what, this is good enough, you tell them good enough is not good enough. Good enough is not good enough. That's all I wanted to say for today. And just like I said yesterday, I'm going to repeat this again. I come in peace and I come in love, but sometimes love comes in the form of difficult and uncomfortable conversations. Have a great day. Please stay safe. I can't even speak right now. I'm so angry. I'm so pumped up, though. Have a great day. Please stay safe. Please stay healthy. That's it. Peace.